It's my pleasure to welcome our first speaker, Moyosola, who has been part of Barnardo's NHS Youth Forum, bringing the voices of young people into design of health services. She has also worked with NHS Charities Together as a peer researcher and a youth health inspector. And if that's not enough, she will soon begin her journey into medicine. It's a privilege to hear her perspective today. Moyosola.
You for having me here today. So yes, my name is Moyosola. I'm part of the Barnardo's NHS Youth Forum alumni. And yes, I've been involved in inspecting youth services in my local community. But I've also been on the other side of it, trying to access services myself as a young person. And today I want to talk about something that many young people I've spoken to, myself included, have experienced, and that is the gap. The gap between the services that are designed for us and the reality of what we actually want, need, and feel as young people. Sometimes services look friendly on paper. They've got colourful branding, a slick website, maybe even a TikTok account, and these are all great and amazing things. But when you actually try to use them, they feel adult-centered. They don't speak our language. They don't work with the rhythm of our lives. And I think that's where the gap begins to open up. I want to share a personal example. When I was trying to get help for my health, I ran into barrier after barrier. And honestly, the biggest barrier wasn't my condition, it was being young. Calling an NHS service itself was a battle, constantly being told to call at a different time. And that time would be during my lessons at school. And the window for calling would be within school hours. How realistic is that for a young person to step out of a maths lesson to hold the line to maybe book a GP appointment? Then trying to use the NHS app, every time I went on, the booking process was confusing and I ended up not getting an appointment. And sometimes I couldn't even keep the app downloaded on my phone because as a young person, you're juggling with WhatsApp, school apps, revision tools, and your phone is constantly popping up with storage almost full notifications. Health apps, unfortunately, become the first to go. That doesn't feel like care. It doesn't feel friendly to a young person. Being a young person where you're just signposted to different services, waiting until a human actually says, I've got you. That's not a service that works for young people. That's a system built for convenience. I've had friends who've just been discouraged from using services, due to the waiting time or due to being passed a route, only to wait and being told that maybe they should be using a different service and start the whole process again. Young people like me sometimes experience this as stress and confusion, especially as shame when information is just hard to access. When you're a young person, maybe sharing a single laptop with multiple people living in your house, or you're having different beliefs in your household about accessing certain services, there are already these barriers. But then when more barriers are being set up by services themselves, it creates that disparity within young people. And I think that leads to an even bigger gap opening up in which certain voices of young people get pushed to the side. Because now the number of barriers isn't equal across the different types of young people. So they aren't able to give their feedback or input on how to make a service better if they can't access that service in the first place. Through the NHS Youth Forum, especially the new hospital subgroup, which I was a part of, I learned something important. Services and professionals often know about young people. They've read reports and they've seen surveys, and that knowledge gets them close to understanding us. But the truth is, knowing about young people isn't the same as listening to young people. And I think that's where the real gap lies. I remember in the youth forum when we were able to share ideas with professionals about patient communication, we suggested a roadmap to health that was a simple and visual way for patients to, see their journey and sort of know what to expect next. For us, it just made sense. But for some professionals, this was a completely new idea. And that's the point, because when young people aren't in the room, even the most obvious solutions don't get designed. And I think that's why Barnardo's, like organizations like Barnardo's, have been really powerful in my life, because Barnardo's didn't just ask me to fill in a survey and disappear. They brought me into a room like this where I could share my lived experience. They involved me in co-designing solution and valued what I said enough to act on it. And that experience made me feel less like a service user and more of a partner. I also had the chance to work as a youth health inspector in my community, where 12 of us young people went out to inspect youth services, CAMs, and even children wards. And we didn't just look at what was written on paper, we checked how those services actually felt to young people. You know, whether they were welcoming, whether the information made sense, whether staff understood that the pressures that young people live under. And what stood out for me was that youth voice can't just be a one-off tick box exercise. It has to be continuous because young people's lives aren't static. What feels accessible to us today might not work in 6 months as new barriers and new challenges keep coming up. And I think the challenge lies in the fact that every community is different. In some communities, young people face misinformation about health. In others, digital exclusion is a huge barrier. And if services don't adapt to these specific communities of young people and children and their families and their lives, then they will often fall through the cracks. A one size fits all solution just won't work. Where we have communities, especially of young people with poor health literacy, and they live in an environment that doesn't encourage or promote healthier behaviors, the whole world is shaped around systems that don't work for them. A generic healthy eating booklet can't be expected to change their behavior, or it can't be assumed that an app will reach every young person. I think the healthiest systems come from young people won't come from repeating old patterns. It will come from listening and trusting, from giving young people the power to shape decisions and not just receive them. I think it will go from ongoing conversations, not just one-off consultations, and from using language and tone that invites the quietest of voices, because usually these are the ones that are most affected but least heard. The voices of young people who aren't just, the head girls or the head boys or the best at talking, or maybe their first language isn't English, And I think that's how a service can really work in real life and bridge that gap between young people and the systems that are made for them. Thank you so much. Just hand over to Naeem.
Moyosola, thank you very much. I mean, just listening to that, I mean, I firstly just want to thank you. Thank you for sharing your personal experiences of the health service and what you saw as areas of frustration, but also areas of opportunities. And it's so important. And I'm so pleased you've joined us today to share those thoughts and ideas with the people who are making the decisions on behalf of children and young people in terms of the services they provide and get. So it's really, really encouraging. I was kind of really taken aback by your point about some of your friends and colleagues and people have felt discouraged by the system, and the system is working against them. I mean, Marcel, if you kind of were advising those who are responsible for designing healthcare services, what would be your top tips to them?
Yeah, I think my top tips would definitely be one, they shouldn't be afraid of young people. I think service users or like professionals, they feel a bit scared of young people. They approach young people with that sort of nervousness that maybe we're going to say something too blunt or maybe something that they can't handle. But actually, I think that's what makes youth voice so valuable, especially with, Barnardo. So I've been in spaces where I've been encouraged to give my complete unfiltered feedback, like not just do you like this, but what would make this work for you? And it's that freedom to say anything without judgment, which led to insights that adults just hadn't thought of. I think as well, involving young people from the start. I think too often, services bring young people in at the very end and it feels almost tokenistic. So if you involve us only once the decisions have been made, we're not really influencing anything meaningful. And the final thing I would say is probably using that Lundy model of participation, which is the participation model that the young inspectors, which I'm part of, they use. And it's based on 4 parts: that's space, voice, audience, and influence, making sure young people feel comfortable to be in that space to share their ideas, making sure their voice influences something, making sure decision makers are there, to listen rather than, oh, you're saying this to this person and then it gets passed on. The message sort of gets diluted if it's not coming from the voice of the young person. So yeah, that's my key tips.
That's amazing, and thank you. And I just love your point about being not being afraid of engaging with children and getting them to start very early in the conversation rather than towards the end. Can I sort of just ask, what's your perception of technology? I mean, you are a generation who are very far more familiar with technology, social media, how we access services and so on. In terms of, again, from a perspective of those making decisions on how health and care should be provided for young people, what would you say to them in terms of advice or some thoughts to consider when designing services with technology in mind?
With technology, there's sort of the pros and cons of using it, because there are young people like this generation, we use technology a lot, and I think it's important to use that effectively as well, because there's a difference between, making a website that you think young people will like, rather than maybe a website that young people would actually use. And without having their input, without having their say, you'd never know. Because I see so many like services, for example, maybe cam services, they have a TikTok account, but there's not many young people engaging with it because the young people aren't making the content, and they're only going to engage with content that appeals to them. So even if the messages are really good and great, if they're not, made by them or catered to what the trends are or what they see in their lives, they're not going to access that information. And I think as well, I think services have to be careful in terms of making sure everything is online, because I think digital exclusion is a real thing in terms of, some young people not having a good Wi-Fi, or some young people not having a computer or a laptop or a device that they can access information on. I think it's important to always have that balance, because there are young people out there who aren't as connected or as technologically advanced as, professionals think they are.
That's a really, really interesting point, so myself. I think there is, what I'm kind of picking up is, as well as digital exclusion is not just for young people. If you look at the elderly and across the demographics, there is an element of, look, we can't access everything digitally. There needs to be that human interaction. And what's really interesting hearing from you in terms of there is a real gap in understanding of what the actual needs are versus what people think the needs are, and how do we close that gap. And best way in doing that is getting those children and young people involved earlier on and listening to them. Can I just ask a cheeky question? I mean, how do you feel? Do you think the adults are doing a good job?
Do you think we are definitely getting so much better than where we were before? Like, I think adults and services, they want to hear from young people now, and they want to hear our voice. But I think it's also about accessing the right voices, because, like I said at the end of my sort of presentation, usually the voices that are accelerated are the head boys and the head girls, and the people who are actually, in the situation themselves. They're not advocating for themselves. It's another voice advocating for them. And I think that's where the gap sort of lies now, where, professionals and services are going out and they're trying to get youth voice, but the youth voice is it's not as diverse as it should be.
That's amazing. A huge opportunity as well. Absolutely, in terms of closing that gap. Wonderful. Thank you very much, Moyosola.